Mental health counselors are asking state lawmakers to approve a bill that would allow them to diagnose patients, a move they say now more than ever is critical. Kayla Green explains why.
Deanna Ferguson is a lead therapist at the Rochester Mental Health Center.
As mental health counselors are trained to diagnose, that's part of our education, and in order to get the degree, you need to have that training.
Yet, she and all mental health counselors in New York State can't legally diagnose patients. A psychiatrist or other provider has to sign off on it. That's where Harry Bronson's bill comes in.
If we are able to allow those folks to offer diagnosis in all parts of the state, then that's going to address the mental health shortage that we currently have.
This shortage has become even more evident during the pandemic. Lauren Gillia is the president of the Mental Health Counselors of Greater Rochester.
I get phone calls every single day of people looking for therapists. If I didn't have to be that middleman, for instance, submit that paperwork to a doctor's signature, and all those types of things, it would allow us as mental health practitioners to focus on therapy instead of all the hoops that I have to jump through to get that therapy approved.
Gillia says the accessibility issue also relates to the financial cost of therapy.
We have to be able to diagnose in order for that client to either get reimbursed by their insurance. For a client to come to therapy and worry about how they're going to pay, that's not what I want to worry about for a client.
Bronson says this bill will streamline mental health care for the community. He says he's trying to get a mental health package, including this bill, into this year's state budget negotiations. In Rochester, Kayla Green, News 8.
All right, Kayla, thank you. Assemblyman Bronson says another important bill in the package would authorize direct Medicaid reimbursement to mental health professionals outside the clinic setting. He says that would allow more people to seek additional care outside a clinic setting, such as a student seeking care outside of school.